Okay, I am super bloody dead. This morning I wrote a letter to said doctor that denied me for palliative. And I also asked them to change their freaking note because it says there's no treatment they can offer me, and that's not true. That my specialists aren't offering me. My specialists are not palliative. I've never seen palliative. So I wrote a letter to her, and I wrote a letter to patient advocacy. Not that, trust me, I totally freaking know. I already told them they can freaking save the paper that they write the form letter on. Because I don't freaking need it. Because I already know they're going to say there's no fault, blah, blah, blah. Because there is no fault. As a provider, you get to say something is above your pay grade. And I actually respect that. My issue is they put in my chart that there's no treatment that their program could offer, which is not true. And my fear is, if I do, sorry, I get short of breath and exhausted. If I do end up in a local hospital that is affiliated with them or at them, which I have not ever had good experiences there, so I will probably not go there. But sometimes if you're unconscious, you don't always get choices, and I don't want it to happen if there is a serious complication of this fucking crap going on in my body, that they see that note and decide not to involve palliative care. So that is my concern for me. I told them I do not want them for palliative care. I asked patient advocacy to please provide staff with education on long COVID and ME/CFS and the complications of long COVID, POTS, autonomic dysfunction, all that stuff, and that it's a physiological disease process, not a psychological, and that the psychological comes from all the medical discrimination and the trauma and the PTSD that we experience. And I sent them research articles. I sent them CDC showing all of this, showing the part that long COVID, that palliative has in long COVID treatment, especially in severe patients. I did all of that. And I did ask them to please not only train palliative, but to please train ER and hospitalists particularly. Just because that's who, usually are the ones seeing us first. And I get that many of these doctors, when they went to medical school, ME/CFS was still thought to be psychosomatic. Shit, there's still doctors out there that think that. All I'm saying is, I had a mental breakdown when I was a nurse during COVID. I worked every single day. I did cut down one of my 3 jobs, but I was back in the gym. I mind over mattered that shit. I tried mind over mattering this, and it just makes me worse. So it's not psychological. Do I have trauma from my experiences with the healthcare field because of this shit as a healthcare provider? Yeah, I do. Specifically hospitals in New Hampshire. I explained that what I wanted from palliative care was less care utilization, that I wanted to not have to go to the ER in the hospital so much, that I, the problem with my great specialty care, which I love, is they stay in their lane and only their lane. I needed somebody to help me figure this out totally and look at the whole thing, the side effects of various meds. I needed them to do palliative care. As a former palliative care nurse for 15 years, I needed them to do palliative care and help me to come up with the goals of care and all that stuff. So, I voiced all that. I told the doctor that I heard that she was a really great palliative doctor, and I hope for others, except me, that she is, and that hopefully this will open up her mind that I understand there are quote-unquote difficult patients with certain diagnoses, but there are difficult patients everywhere. As a nurse for 15 plus years, trust me when I tell you, there are difficult patients everywhere. And sometimes your grumpy, alcoholic, old veteran is the best patient you will ever have. So, I had to draw 11 vials of bloody blood off me today. I am hoping these test results come out correctly. I hope I did them correctly. Thank God for my aide being here and her helping me and making sure I checked everything off correctly. Because my port was moody. I had to do a syringe draw. But just the fact that it was out of routine and took so much cognitive... I'm sorry, my words a little bit. Is that it took so much cognitive, I really crashed, and then I had OT telly afterwards, and that freaking crashed me. And I've been barely able to open my eyes. I'm already doing my fluids. I'm hoping that'll help a little bit. I'm just... I hate my coloring. Oh, they put self-referred, and I'm like, I wasn't self-referred. My doctor has been trying for 2 years to find me palliative care, and it took me 2 years to come to the idea of doing palliative care. So, and that was as a palliative nurse. We tell everybody to access palliative care early in your serious illness, chronic illness, because it improves quality of life and all that stuff. But apparently I don't get that. I'm kidding. I have, like I said, I have referrals into other places. And I do have a name of a doctor who is willing to learn long COVID and ME CFS. She's working with a friend of mine. She's out of Maine, so I'm really trying to wait to find out what's happening with telehealth before I do that. But if push comes to shove, I will just go to her. It's just, I really do want somebody that can come to the home and check on me and hopefully save me from an ER visit.